Well, hey guys, I'm Dr. Ben, founder of Well Health and Chiropractic. If you are somebody who suffers from headaches, tension headaches, migraine headaches, I really want you to watch this video because I'm going to show you literally what causes those headaches and the number one fix to get them gone forever. Listen, I totally get it. Headaches can be absolutely debilitating. Specifically, there's a very specific type of headache that I'm about to talk about right now, and that is the type of headache that comes from the back of the skull, right back down here in the upper part of the neck, goes back up behind the skull, behind the eyeball in the temporal region. That is a very specific type of headache that is easy to get rid of. And I'm going to show you really what causes it and what we got to do to fix it. So hang on tight. Here we go. By the way, I talk really fast. If you take notes, good to know this is a video. You can just replay it. But here we go. So this is basically your skull. So facing from the back, this is your skull. The top bone is kind of like a line, and then these squares are the second and third vertebrae in your neck. The number one thing that causes these headaches is we wind up injuring this nerve in the base part of the skull. It's actually kind of in the upper part of your neck. It's called your greater occipital nerve. That is the nerve that comes up there, goes up and innervates, again, the back of the head, behind the temporal region in the eyeball. That's a classic tension headache, and it can be a classic migraine headache because migraines generally squeeze the whole skull, and it's usually the same thing. So what happens is that nerve goes back there. If there's any pinches or pressures on that nerve, we're going to see a headache evolve. So the problem here, or the function of our bodies, the way that God designed us, He did an amazing job designing our bodies. However, we do have what's called a suboccipital triangle of muscles back here. What that is, there's a muscle that goes from the base part of your skull down to the top of your second vertebra like this. You got another muscle that comes all the way out here to the tip of that first vertebra, and you got another muscle that goes from the second vertebra to the first vertebra. Well, we call that our suboccipital triangle. Well, this nerve lives inside of that triangle and actually has to try to go out of that triangle. And the real issue here is when we have our whiplashes, like we talked about, our injuries. We spend too much time on computers. What we wind up doing is damaging these muscles, and those muscles, when they get injured, will grab a hold of and hook onto that nerve. And when they hook onto that nerve, that's when we see our tension and our migraine headaches go through the roof. Because essentially, that muscle fiber runs like this, right? It's nice muscle fibers, all supposed to do that so that way it can contract easily. Well, when you injure that muscle, whiplash injury, car accident, too much time on the phone, you wind up injuring that muscle. Your body lays down scar tissue in that muscle to let that muscle heal up. Unfortunately, if this nerve is going through that muscle, it's going to get bound up by that scar tissue. Now, why this is a big deal is anytime you try to move your neck, that muscle is going to be hooked onto that nerve, and that muscle, when it contracts, is going to stretch that nerve. Well, guess what? Nerves hate to be stretched. When that nerve gets stretched, it shoots pain up behind the eyeball in the back of the skull. You already know this. If you're somebody who suffers from headaches, and particularly a lot of them, you know that if you fish your fingers back behind your skull like this, you're going to find very sore spots. And really, when you push on them, it almost relieves the headache a bit. And that's because what you're doing is you're essentially stretching that muscle in the direction that that nerve is so that your nerve can relax, right? Cool stuff, right? So we don't need, heavy narcotic medication to remove headaches. What we need to do is what? Right? You should be already kind of picking up what I'm putting down here, is we need to get these muscles, get that scar tissue out of those muscles. Now, it's a bigger picture than that, and that's where chiropractic comes in. I actually practice a very specific corrective technique where we work on moving the bones in the neck to take the tension off the muscles. So let me show you what this looks like. When you get into a car accident, you wind up moving these vertebrae in your neck and stretching those muscles, ligaments, and tendons, right? Which is what's affecting this. And then when it tries to heal down, it's got that scar tissue. So what I do as a chiropractor is I physically move those vertebrae back into their correct position, and then we work on the muscles, ligaments, and tendons to reform them and reshape them. So that way we not only do we unpinch that nerve, but we permanently unpinch that nerve. And that is such a big deal. So listen, if this is something that you suffer from, we've got a couple of big fixes that I'm excited to tell you about that's going to change your life forever. I'm going to pick on, of course, Jennifer, one of our patients, 22 years of migraine headaches. She was a dispatcher for a fire department, which I could not imagine. 4 kids, dispatcher for a fire department. She had 4 migraine headaches a week. unbelievable. For 22 years, by the way. She came into the office. She did the techniques that we're going to talk about here in a minute. And within, I think, 2 or 3 weeks, all of her headaches went away. And that was like 6 years ago. Like, she doesn't even have migraines anymore. And she said, listen, if I would have known about this 22 years ago, I would be a different person. So listen, if that's you and you're suffering with that, I'm just going to encourage you to take advantage of the 2 things that we can do to help fix you up.